How can relapse be prevented? Patients and their families should be involved in relapse prevention in order to reduce relapse rates. There are 4 steps in relapse prevention. Understanding the cues in relapse, finding out relevant issues, proposing preventative measures, and establishing supporting systems. Step 1. Understanding cues in relapse. Cues in relapse vary from person to person. Early detection benefits early intervention, resulting in better relapse prevention. The cues fall into several categories: cognitive and affective symptoms and behavioral symptoms. These include difficulty in concentrating, worrying, mood problems, anxiety, suicidal ideation, suspicion, suspecting that one is under surveillance, reappearance of auditory hallucinations, and oversensitivity to sound. Behavioral symptoms include frequent insomnia, loss or increase in appetite, alcohol or drug abuse, aberrant behaviors, repetitive behaviors, disorganized speech, social withdrawal, lack of interest to surroundings, indifference to appearance, behaviors and changes in habits. Upon recognition of the cues, families can encourage patients to talk over the problems openly and consult doctors together to prevent the situation from deteriorating. Step 2. Finding out relevant issues. Relapse may be caused by certain modifiable factors. Patients should be encouraged to identify issues related to relapse, propose measures to enhance coping abilities, and attempt to handle the problem optimistically. This helps stabilize the condition. These inducing factors may include lack of sleep, difficulties in learning, social conflicts, challenges in life, abusing alcohol and drugs, taking drugs without following instructions, and facing setbacks. The above-mentioned situations are just examples, and since everyone's experiences and reactions are different, carers should try to cope with patient situations accordingly. Step 3. Proposing preventive measures. After identifying relevant issues, patients and families can propose measures to prevent relapse. For example, making a habit of taking drugs regularly, setting healthy living patterns, and handling the sources of stress. Families can propose the measures together and provide support and assistance when necessary. Some patients may think that they can stop medications on their own accord, provided that the symptoms are getting better. However, this increases the chance of relapse. Despite the resolution of symptoms, doctors will advise patients to take medications for a duration of time based on different needs, so as to prevent relapse. Step 4. Establishing supporting systems. Patients may display involuntary symptoms and emotions. If carers lack understanding of the illness, they may blame the patients wrongly. Thus, families should avoid criticizing patients and learn more about psychosis and provide care and encouragement and support. Unrealistically high expectations should be avoided in order to reduce relapse rates and to help patients adapt to a new life. Other than families, people who have close relationships with parents, such as friends, colleagues, and medical professionals, can also be part of the supporting system. Patients and their families can adopt the following method to write down a simple relapse preventive plan.